We have the first presentation by Dr. Aurore Perrault. So Dr. Perrault is a postdoctoral fellow in my lab. She completed her PhD at University of Geneva in Switzerland, I think 3 years ago, 4 years ago, some time ago, where she did a lot of interesting studies looking at sleep and sleep stimulation or sleep modification using different interventions, and particularly this nice design with vestibular stimulation using rocking bed system. And that's what she's going to discuss today. Now, Aurore is also working in my lab looking at insomnia populations and different interventions aimed at improving their sleep. So Aurore, whenever you're ready, go ahead.
Thank you for the nice introduction. All right, so today is about sleep, so let's start right away about sleep. So as we know, sleep is vulnerable. So by vulnerable, what do we mean? It's not rigid. What you're gonna eat, if you exercise, or if you take drugs, drink alcohol, or even how you felt before going to bed, if you fight with your partner before going to bed, all this will impact your sleep. We also know that sensory stimulation can also impact sleep parameter beneficially or negatively. One of the most famous example will be noise. We don't like sleeping with traffic noise. It actually impacts sleep. We wake up way more, etc. But we also know that if you apply sound at the correct frequency at the correct moment during sleep, it can actually be beneficial, especially for memory, for example. So now another sensory stimulation linked to sleep that we experience in our daily life is actually rocking stimulation. So we rock our baby to sleep, we fall asleep in transport, and we have the best nap in a hammock. So the question was basically how this rocking stimulation can affect sleep, and can we actually assess it objectively? And that's the question that Laurence Bayer in Switzerland asked herself when she created this nice rocking bed. So as you see, it's rocked laterally, very gently at 0.25 Hertz. So it's super slow. It takes 4 seconds to do a full rocking cycle. And she first used it on a nap study of 45 minutes in 16 healthy sleepers. And what she found is, compared to a stationary nap, people were falling asleep faster, but they were also boosting some very important brain oscillation linked to sleep and memory. They are called spindle and slow oscillation. So because of these nice preliminary results on the effect of rocking stimulation on sleep, we wanted to go further. And this time we did a whole night study. So we invited 17 healthy, good sleeper, young, to come to the lab 3 times, habituation night, but also one night where they would be in stationary position, and one night where they would be rocked in the rocking bed. What we find compared to a stationary sleep, when you're rocked, you fall asleep faster, especially in N2. You spend more time in deep sleep, the deeper sleep, which is N3, which has been linked to restorative properties, memory consolidation processes, etc. And we also found that they spend less time in lighter sleep. When we went a bit further, we also look at the brain oscillation that I was talking about that are linked to memory, and we look at spindle. So spindle will actually increase when you are rocked. So you have more of them when you're actually rocked. And what we know about spindle is, yes, it is linked to memory, but it's also linked to sleep continuity. So we checked. So like I showed earlier, there is no change in the amount of awakening, so it's not awakening you, but we also look at arousal. Arousal is micro awakening that you have naturally during sleep between 3 to 15 seconds. And what we find is actually when you're rocked, you have less of them. So you have less micro awakening during the night. And it was nicely correlated with the increase in this spindle brain oscillation. So we also look at another very important brain oscillation linked to sleep and memory, which are called slow oscillation, which is an oscillation that basically oscillate under 1 Hertz. And what we find is an increase in the number of slow oscillation, which was linked to the fact that you spend more time in deep sleep, which is filled with slow oscillation, but we didn't find any change in the density of it, nor in the characteristic of them, no change in amplitude, for example. But what we notice is actually the periodic rocking movement caused a periodic occurrence of slow oscillation, which is called entrainment. So how we did that? We put a marker every time that the bed hit the left side, we will have a trigger on the EEG, and we will apply so every 4 seconds you will have a trigger, and we will apply this marker virtually on the stationary night. And then we calculated peri-event time histogram around the rocking marker. And basically, we saw a uniform distribution when you're stationary, but when you rock, the slow oscillation clustered at specific time point with respect to the rhythmic motion, which you see here with the strong peak. We also look at whether or not spindle will be affected by this. And indeed, they are as well clustering. So rocking stimulation seems to entrain your brain oscillation into a cyclic occurrence. Interestingly, he did not affect the relationship that slow oscillation and spindle have, which is called slow oscillation sigma coupling. So it did not affect the phase coupling nor the synchronization of both these events together. So what we show in these papers is rocking stimulation linearly at 0.25 Hertz seems to beneficially impact sleep, especially sleep entrance and maintaining sleep, boost brain oscillation, but also we saw that it actually reinforced declarative memory consolidation. We use a word per task, and we compare the performance between morning and evening, and what we find is actually the overnight improvement is better when you get rocked rather than when you're stationary, which is probably linked to the increase in spindle and maybe the entrainment of your brain oscillation. So now the question is, but how does that work? And usually when you want to understand mechanism, you actually turn to animals. So we did rock some mice. So we create this nice platform to rock the mice. And what we find is actually they also responded beneficially to sleep. They fall asleep faster. They spend more time in non-REM, which basically will correlate to our N3 or N2. And they also spend less time awake. Not though that for them to have a benefit gain, we needed to rock them faster, which makes sense because in mice, you often need 3 to 4 times stronger stimulation in order for them to have a reaction. So we saw like a nice gain from the rocking stimulation when it's at 1 Hertz. We also found that the beneficial effect of rocking require a functional autolytic organs of the vestibule. So how did we do that? We use autoconia deficient tilted mouse, which basically they have a spontaneous recessive mutation in the OPTO1 gene. This gene regulates the formation of the autoconia crystal in the inner ears, which are basically essential for the encoding of linear acceleration and gravitational perception. And what we find is those that have an homozygous, that were homozygous tilted mice, they did not benefit from the rocking stimulation. So now that we understand a bit more how that works, we also know that it has benefits for healthy sleepers and mice. The follow-up question is, can we actually apply this in clinical population? Could we use the rocking bed as a therapeutic intervention? And this is what we tried to do with 16 young individuals with probable chronic insomnia. So they were matched with the good sleeper age, so between 18 and 28 years old, and they all complain of severe difficulty falling asleep and or maintaining sleep for the past 3 months. So they were basically what we call chronic insomnia. And what we find is we find the increase in spindle density. So we did find the same mechanical effect of the rocking stimulation in terms of brain oscillation. But for the sleep benefit, that was a bit more heterogeneous. While for the healthy sleeper, we find a homogeneous reaction with the increase in N3, etc. For the insomnia, it was more heterogeneous, which matched with the disease per se, because we know that insomnia is very complex, very heterogeneous with different type of profile. So the way they react was very much as well complex. But what we find as a group is they all decrease the time spent awake during the night when they rocked. And conversely, they also increase their sleep efficiency. Now, what I'm trying to do here in Montreal is we're trying to tackle this idea that maybe we could use the rocking bed as an therapeutic intervention in seniors. So we know that it's normal that sleep change with age. It doesn't go in the right direction in the sense that more difficulty falling asleep and maintaining sleep. And indeed, more than 40% of the senior does report insomnia complaint, as well as cognitive deficit, including memory issues. And the treatment is always very much challenging in the senior population. So could we use the rocking bed and its benefits on sleep, but also on memory to maybe either improve seniors that already have insomnia complaint, or maybe prevent seniors to actually have this complaint? In order to do that, we receive an ODAS grant in collaboration with Concordia, UGM, University Montréal, and McGill, in order to construct our own rocking bed. So the difference with what I've been done so far, it's that it will be an at-home bed. Everything has been done in lab one night. What we want to do is create a bed that could be applied in your own house. You would put your own bed frame, the rocking system, and your mattress on top of it, and you can be rocked for several days. So that allows us to see the effect of rocking during several days, but also to look at sleep and memory at with seniors with and without insomnia. So I hope that one day I will be able to tell you all about it. But for now, I would like to thank you for your attention. I acknowledge the Swiss team as well as the rocking team here in Montreal, and enjoy the next talk.
Thank you very much, Aurore, for this very interesting talk. So we have a couple of minutes for questions for Aurore before we move to the next presentation with our guest speakers. So there's a questions from the chat. Why are sleep treatments more challenging in seniors?
So good question. So we know that the benzodiazepine or any sedative treatment is not really advised for the aging population because it does like negatively, we have negative effect on cognitive deficit, but also increase the risk of falling, increase the risk of mortality. So it's not really recommended. Then there is another gold standard treatment, which is called CBTI, so cognitive behavioral therapy for insomnia, for example. It works, but the issue is it's very expensive, not easy of access, and it's an 8 to 12 session per week, so it's not always easy to follow up. And it is worth noting that also 60% of people respond to it, but there is still 40% of insomniac that actually does not respond beneficially to it. So that's why maybe the rocking could be a good alternative for those resistant to CBTI, for example.
Okay. So there's a couple of questions. So interesting to filter those that are the most of interest. So what are the different speeds of your bed tried?
So our bed in Geneva was at 0.25 Hertz. We tried faster and people were starting to have nausea. So that's why we stopped at 0.25 Hertz. In Zurich, for example, they also try like other frequency and also other axes, so up to down, up to front. But right now they didn't report as beneficial effect as the linear acceleration rocking stimulation at 0.25 Hertz like we did. And we actually, the mouse study that I briefly showed also proved that there is a very specific linear acceleration that the brain seems to respond to, even the mice, and it was linked to that 0.25 Hertz linear.
So there's a couple of questions about how can people join the study. So if you are interested, you can write to us. You can type SCN Lab on Google and you'll find our coordinates to contact us. So I'm sorry?
Hopefully soon we can.
Yes, exactly. So just for the sake of time, we're going to move to the next speaker. And of course, if you If any of you have more questions, you can also contact Aurore directly by email. Thank you very much, Aurore.
Thank you.